you don't believe in it?
We're going to wait for Mark's audio to connect. We should be good to go, Mark. Just unmute your microphone. Mark, your microphone is on mute.
Here we go.
We're good to go.
Sorry about that. Welcome to the Nonprofit Report, your update on nonprofit organizations, issues, and leaders. I'm your host, Mark Oppenheim, and today we're discussing organizations that support those living with limb loss. A very uncomfortable topic, but let's make it comfortable. I'm looking forward to learning more from our special guest today, Mary Richards, President and CEO of the Amputee Coalition in Tennessee, and Lucy Fraser, Executive Director of the Limbs for Life Foundation in Oklahoma. And a reminder to Zoom attendees that we'll take 3 snap polls during the show and we'll announce results. And questions submitted through the Q&A function at the bottom of your screen will be included in our discussion. And please do ask questions. So thank you all for joining us. I'm going to set you up and we're going to go to you, Mary. 2 million people in the U.S. live with limb loss, and in less than 30 years, that number is going to more than double. And it's more common than people realize. 28 million Americans are currently at risk for amputation, and by tomorrow there'll be another 507 individuals facing the emotional, physical, lifestyle, and financial challenges that come with this condition. So, Mary, tell us about the Amputee Coalition and how you would help me if I were to be so unfortunate as to be in an accident, to as a soldier have experienced an amputation, or through some sort of condition such as diabetes had to live with limb loss. How would you help me?
That's a great question, Mark, and thank you so much for having us here and for having this conversation about an important topic. And one of the tenets of the Amputee Coalition is that limb loss is not uncommon and is becoming less uncommon every day. It is a part of the foundation of our organization, as well as 2 other tenets. So no amputee alone, I'll talk a little bit about that, and living well with limb loss, that there is living life to the fullest after amputation. The Amputee Coalition does serve the 2.1 million Americans living with limb loss and limb difference, so folks who were born with a congenital limb difference. We believe very strongly that if you were to, the most common causation pathway to going through an amputation surgery is peripheral artery disease, vascular disease, and diabetes. That's the overwhelming majority of the 185,000 amputation surgeries every year through that causation pathway. Trauma is also very common. So if you were in a car accident or had an accident of another type, we also work very closely with folks who come to our community through that pathway. Cancer is another pathway, as is sepsis and infectious disease. And sadly, with COVID-19, we also saw a preponderance of blood clots that can cause limb loss. And much like sepsis, it's a systemic illness that has you in emergency care and in ICU care for some period of time before you're actually able to navigate the loss of limb, right? That is one part of.
So this could happen. This could literally happen to me tomorrow. If I was in an automobile accident, if I was living with diabetes and I had an episode, if I had a blood clot, this could happen to me tomorrow.
That's right. And if it would, then there are things. We have the National Limb Loss Resource Center, which has unbiased, validated information. We have a packet that we can send to you and to your family members to help you navigate the amputation itself and recovery, rehabilitation, and return to community, return to work, whatever works best for you. We believe that patients, so the Amputee Coalition is a little bit of a patient advocacy organization, a little bit of a disability organization. And there are times when we think of ourselves as being patients. There are times when we're just members of the community. But in that hospitalization period, in the period of recovery, as we are adjusting, as our family is adjusting, as we're working with our workplace and others, we have a publication called First Step and Your New Journey. And it is sort of the what to expect when you're expecting, but for amputation surgery, if you're familiar with that book that helps folks who are dealing or who have a pregnancy. We hope to make sure that whatever the causation pathway, there is a life lived well with limb loss. It does engage some of the work that Lucy does. We know that there's also coexisting conditions that need to be well managed. We want for folks to have unbiased information about what to expect, how to navigate your different healthcare providers, how to make sure that you go through the initial period of recovery and then rehabilitation to be able to set patient-asserted recovery values, help us to achieve better health outcomes. And then we also want to pair anyone who's going through an amputation, we want to pair you with someone who's gone through something similar. We have a certified peer visitor program, and that is someone who has lived experience and expertise that will help you go through the experience of hospitalization and recovery. How do you talk with your spouse or loved one about the changes that you're experiencing? How do they get the support that they need? We have a caregiver program to help folks with certified peer visitors on the caregiver side. And then we also have support groups that there's one every single week online in a period of COVID where people are at higher risk. We want for folks to have in-person engagements when it's safe and helpful, and online and virtual engagements when that's necessary. And then once you get to a period of, through that period of recovery and rehabilitation, when you have a sense of self and a sense of wanting to give back, lived experience is expertise that we want to share with others. And when that moment happens, becoming a certified peer visitor yourself is something that I think people find. We want to help to empower people living with limb loss to live the life they most want to live.
So let's get back to that. Lucy, you wouldn't know whether I am missing a leg.
That's correct.
It wouldn't affect my work as a search professional. I do executive search for nonprofits. You wouldn't know this, right? I don't know whether you are living with limb loss or whether any members of your family is, just by through these interactions. Yet our attitudes sometimes are far different than the objective impact that it might have in our workplace or in our friendships or whatever. Could you talk a little bit about how your constituents see the difference between their lives before and after, and what kind of ways in which they not only have to adjust themselves, but also educate people who have not necessarily had to themselves live with this condition?
Well, the Limbs for Life Foundation, our main client is the person who has no access to healthcare, either because of their income level, the inability to afford insurance, and our main goal is to get those folks provided with a limb so that they can get back to life as they remember it. That may mean back to work. It may mean back to self-care. It may mean just being able to cook dinner for their family. But whatever it is, they want their life back. And we have a board member who's an amputee, and he has often said that there's a cure for amputation, and it's a prosthetic limb. And we are able, that's what we're here for, is to provide that piece of normalcy that can put the amputee back to work, back to life, back to standing on 2 feet, and being able to assist in their personal care as well as that of their family.
And it's quite extraordinary. Now, I was in I was in a restaurant in a place, rather remote place, and in walks this gentleman walking with a normal gait until he came around a corner where his legs were visible. I was completely unaware that his legs were both prosthetics. It's quite amazing what can be done today. Could you talk a little bit about how sort of the supply chain of finding somebody a prosthetic and getting them fitted and getting them trained to use it, particularly somebody who does not necessarily have the income level that allows them to take off of work and allows them the luxury of being able to afford this service, which is so important to their lives. How does that actually function? If I came in and I said, look, I have a need and I can't afford it, what happens there?
Well, for Limbs for Life, what our routine goes like this. We ask people to complete an application where they provide us with information about their family size, their income level, their access to insurance, when the date of their amputation was, how long they've been healing. If it's an old amputation, are they currently wearing a prosthetic? And if so, how old is that prosthetic? To get the basic idea of who we're dealing with. Then what makes our service work is that we partner with prosthetic clinics across the country. Right now we work with about an average of 300 a year. And what we see is that people in the prosthetic and care industry are caring people, and that's why they're in that job. If they're not, then they don't stay long in that job. So most prosthetic clinics are helping people and will do some pro bono work. And what Limbs for Life does is we help those clinics to be able to do more of that. And that's by providing a small stipend for the payment of their time and their work to make the fitted socket that fits the leg to the residual limb, as well as we provide donated parts as available. We have a warehouse of used and donated new equipment, and it's quite a system here. I just was glancing through our inventory notes. We have sent out or distributed 355 sets of donated materials just since January 1 this year. And that's internationally. So
that's amazing. What is the average cost, Mary, of a prosthetic, and in terms of not the donated limbs, but also the manufactured new limbs? How much does it cost to first supply the limb, but also then to get it fitted? And then Lucy, if you can jump in and talk about how you ameliorate that cost.
So it's a little bit of a complicated answer, but I'll try to keep it quick here. So the cost of a prosthetic device and the care for the device is bundled. So it's one payment for both. And it depends on what type of healthcare insurance you have or not. As Lucy was saying, not everyone does have health insurance. But for example, if you're in the veterans health system, it is going to be vastly different than if you're someone who is on Medicare or Medicaid, which folks who are living with a disability should be able to. You can call the National Limb Loss Resource Center. They'll help you with putting in an application. to become, so Medicare serves folks who are 65 and older and people living with disabilities. And if your amputation surgery puts you in a place where you have a disability, you can apply for Medicare. And if you are then in a certain category, you may also qualify for Medicaid, which is the state-run program that is partially funded by the federal government. So all of that means that from a patient perspective, what I care about most is not the cost of the device to others, but what is my out of pocket? How do I obtain access to needed healthcare, including prosthetic care? And I think that Lucy does a really great job of kind of figuring out how on the ground it works. But the cost can range significantly as well. So if my goal after limb loss is to be able to go grocery shopping on my own after upper limb loss, that is a really important goal for me. And someone else may need a running blade to return to running marathons, which would not be the case for me. But we want for folks to have the devices and the care that's necessary for them to return to that life that they want to live. And I'm not trying to dodge your question, but I also know that the wide range of expenditure that's related to the device itself may or may not actually land on the checkbook or the pocketbook of the patient. It really has a lot to do with insurance coverage, the type of healthcare finance system that you're a part of. The VA is very little cost sharing for patients. I know that my dad is a veteran. I know there are lots of veterans who may or may not get their care through the VA. I can't tell you what a wonderful partner they've been to our organization and to the folks that we serve. And most veterans come to the limb loss community through the same pathways as everyone else, diabetes and vascular disease. So we really want to encourage folks to think about the tools that are available, and we can help you with those applications and some of the bureaucratic part of this so that you get the care that you need, so that you can get back to the soccer field and watch your grandkid or get down to the market and pick out your own apples. I mean, we want for folks to be able to do the life that they most want. And from my vantage point, that's as impressive as some of the folks that we do see during the Paralympics. We all have our own goals and we all need to be able to live a life that is most fulfilling to us. But let me hand it over to Lucy to talk a little bit about, with the complicated healthcare, like the finance component of healthcare, what I think Lucy and I both orient ourselves around is the patient experience. How do we help that family? How do we help that person? And I will say that we also have legislation on Capitol Hill called the AAA Study Act that will, through a nonpartisan research project, we want to understand who is assessed for a prosthetic device. Only 35% of people living with limb loss and limb difference have access to a prosthesis. Why is that? Can we help folks have the assessment as well as the prosthetic care and the assistive technologies that are necessary to return to a life lived well? And do people do better in one type of healthcare insurance environment than another? And if that's the case, how do we take those experiences and stretch it out across the other types of care delivery systems? And we really think that there's a lot to be learned and the basis for public policy improvements for years to come. I thought I would keep it quick, but I really didn't, Mark. So let me hand it back to Lucy to talk a little bit about how they help people live that life that they want.
You make a few important points. Let me just highlight them, and then Lucy, if you could comment. First of all, 67% of the people who responded to our last poll say that they know someone or themselves have experienced limb loss. So it's quite a broad swath of people who are affected by this. But you make a couple of really important points. First of all, you make the point that prostheses are purpose-built. So the purpose for which you're going to use that prosthesis, and there might be multiple prostheses that are required for different purposes in a person's life. It's so incredibly important. The second point that I think is so very critical here is that we don't have equal access or equal capability for access to these devices, to the training, to the support. And it really does depend on the relationships that you have, the wealth that you've been able to accumulate in your life, the circumstances, whether you're a veteran or not. And you could have neighbors literally having completely different experiences at completely different cost levels. It seems that the way we are approaching this may not be particularly optimized for the impact that we want to have on people. Lucy, could you comment on those two issues? One is the fact that people have different needs at different stages in their lives. And those, how do we accommodate those various needs, particularly people without the means to afford these various devices? And secondly, the inequities that are built into the system, and whether we in the United States are actually doing as well as other industrialized countries in this regard.
Mm-hmm. Our client is usually the person living on that edge of poverty, and many are impacted by limb loss, as Mary said, from diabetes and vascular disease, which is worse in those states that don't have healthy outcomes.
So do your services focus on those states where there is less insurance available to people?
Yes.
How does that work? I mean, if you look at the United States map, how is it colored in
Okay.
terms of your services?
I'm glad you asked that question, because that's something that's very close to my heart. There are in all 50 states, Medicaid, which is the state produced program to provide health care for those in poverty, living in poverty. The state Medicaid will provide limbs for people under the age of 18. Everyone, every child can have access to a prosthetic. But at the age
Medicaid, that's all 50
through Medicaid, that's all 50 states. And again, we're talking about those of a certain income level. At the age of 18, in many states, that coverage stops. So we have this population of young people from 19 to 25, because maybe they don't have the ability to go straight into a job where they have quality health insurance, who are living with a limb that was made for them when they were 16 or 17 years old. And they've grown, they've changed, they have broken parts. A limb is like a shoe. They wear out. So even an adult needs a new limb every 3 to 5 years. We've seen people who are walking on limbs who have been wearing them for 12 years. You make do with what you have oftentimes if it's not accessible to you. But to address the point of states, we see more applications and provide more services within those states where Medicaid does not pay for adult prosthetics. Those states are Oklahoma, Texas, Mississippi, first off, top of the list. And then some of the other states that have limited coverage are Florida, Alabama, Louisiana, Tennessee, and Georgia, and North Carolina. So we get a lot of clients from those areas as well. When it comes,
that's very interesting. So you have here some of the other downstream effects of the embrace or lack thereof of health funding and insurance changes to insurance policies. It's just very, very interesting to see those kinds of changes have such an impact on people. Mary, if you take a look at mapping the work that you do for the Amputee Coalition, do you find a similar mapping in your experience to what Mary was talking about, where there are certain areas of the country where the response, our collective response, helps people with limb loss more than others? What is your experience in comparison to Lucy's?
So the Amputee Coalition was founded, and we were based in Knoxville, Tennessee for many years, and we're now based in Washington, D.C. And we have a national footprint. So we do education, advocacy, support, and prevention work across the United States, and we're involved in public policy as well as the education and information that folks need to live life well with limb loss through the Resource Center. So I think that our missions are slightly different, whilst we stand in like a slightly different place, looking at a shared community with shared values. And I think that that's where partnership is always so important. I don't need to be an expert the way that in the areas in which Lucy is an expert, because we can partner with her instead. And the National Limb Loss Resource Center points people to Limbs for Life when they need assistance with obtaining a prosthetic device. So that's a wonderful way in which I don't have to replicate. We do what we do, shared community, shared values. Lucy does what she does, same vibe, right?
And so, Mary, we send many people to the Amputee Coalition for your wealth of information and resources every day.
And thank you so much, because both our organizations and both of us as people want to make sure that every American who needs the supports in order to live that life well with limb loss finds both of us in our organizations and our other partner organizations who can help them achieve that goal. I will say that in terms of our footprint, we have 80 some hospital and rehabilitation partners across the country. We are actively seeking partnerships with organizations that have a depth and breadth of expertise in that shared community. So, we work with the National Health Council on public policy issues. I think that one of the things that's important to us is that health insurance needs to be high quality, patient-centered health insurance needs to be available to everyone who needs it. And the Affordable Care Act is something that was a bill that was put in place, and we've heard a lot about the different elements of the ACA. But the Affordable Care Act also said that baseline health insurance must cover prosthetic devices. And so but implementation is also something that public policy organizations and advocacy organizations need to stay after. So that's part of what we do in Washington, is to see why it is that policy and practice don't look the way that we anticipated that they would.
So my question in linking to Lucy's was really about, Lucy made the point that in certain states, the need is higher than in certain other states.
Yeah, and I'll just share that too, that African Americans are 4 times more likely to have limb loss and limb difference, and Latinx Americans are twice as likely to have limb loss. We do have the social determinants of health, they're a component of that, but better understanding, as we know that the diabetes epidemic has hit certain communities harder than others, we know that these are communities that are not special populations for us. They are critical core populations for the limb loss community. And how is it that we can make sure that our services and supports not only reach them, but are designed with an iterative process, a dialogue to ensure that they're culturally sensitive, culturally relevant, and are in the communities that need us most. And I think that it's a challenge for all nonprofits to ensure that we are serving those who need us most. I know that Lucy's focused on that, whether it's socioeconomics, race and ethnicity. We know that there are pockets of need that we all need to make sure that we are focused and really intentional about reaching those communities.
So when you talk about your analysis of need, Lucy's went along geographic lines. What you're saying is that there might be some geographic locus, but it's also about race, ethnicity, certain conditions that actually cluster in certain groups and therefore result in limb loss. Is that what you're basically saying in terms of, as you look at a map of the United States, in terms of how you see the concentration of the problem?
Yeah, I think that there is more study that needs to be done to better understand why it is that Black Americans are 4 times more likely. And that's something that we look forward to partnering with our friends at the National Institutes of Health to better understand. And Centers for Medicare and Medicaid Services also has some research that they do through the Innovation Center. There are ways for us to better understand the why of it all. But there's also challenges related to delivery of healthcare in super urban and super rural areas. So telemedicine, telehealth, access to, if you have bilateral upper limb loss, you need a specialist who knows how to fit upper limb prostheses and has some expertise. Bilateral is more complicated. So that means both arms are involved. So how is it that we make sure that if that person is living in rural Montana they get the right prosthetist, the right physical therapists involved in their care delivery team to make sure that they do very well. So I think that race, ethnicity, socioeconomics all play a role. We want to better understand what that means. And my point of view is, when you know that there are folks who are disproportionately impacted, how is it that we're making sure that we're orienting our services and supports to best meet the needs of that community? There's no, in all of the history of patient advocacy, shame and blame have never gotten us anywhere. So this is not to say that there are people who are at fault for losing a limb. That is not helpful. That is not a way that we think. What I do think is, when you know that there's a part of our community that needs us, we got to show up. And how is it that we are listening and learning and showing up where we're most needed?
So we're coming to the end of our time. Just in a very short nugget, Lucy, if you could give us some advice on how we should reshape services so that more Americans can, who live with limb loss, can live a really full and productive and enjoyable life, regardless of income. How should we be thinking about how the U.S. should function to embrace people who live with limb loss? And then, Mary, if you could also give your comment, how should we change? Lucy, what do you think?
Well, my feeling is that the people who live in the states where they are aware that Medicaid does not cover basic prosthetic limbs for adults, please make your voice heard, make it known, call your congressman, tell them this is not right. In a state like Oklahoma, where I live, if you lose one limb, you cannot, that in itself does not afford you disability coverage, because they will give you a wheelchair, but they will not provide you with a leg. And there's just something wrong there. We need to allow our people to live their best lives.
And on to Lucy's, the idea that we are able to better identify what types of healthcare interventions allow people to live the life that they most want to live helps all Americans it helps the health economy, it helps workplaces. Disability is also a part of diversity, equity, and inclusion in the workplace. We partner with a group called Disability In, and they have an index of companies that have a diverse workplace, including people living with disabilities. And we know that that improves the bottom line for publicly traded companies and anyone else. So while we are a nonprofit, we also know that most of the folks that we serve work in a corporate America or in other places, and we know that that is a benefit to companies to have people who are living with disability who are part of their workforce. I do think that the Amputee Coalition, through our advocacy work, you can come and look up your representative and communicate with them through our website. The AAA Study Act does call for better understanding why it is that some folks are getting a prosthetic device and others are not, and then being able to take those lessons learned and applying them across the different health insurances to ensure that all Americans have access to the care that they need. We know it improves quality of life. We know it extends life, and we know that it can actually help both our friends and neighbors as well as our families themselves, as we make sure that people get the care that they need when they need it most. And then I do think that in terms of, the Paralympics just ended in a couple weeks back now. And I think that there is something about American exceptionalism that is displayed in a resilient and agile community. Folks living with limb loss are folks who know how to adapt. And I think that especially in a COVID-19 environment where we're all trying to find ways of finding our own resilience and finding our ways of navigating uncertainty in life, I have the great pleasure of working with a community of people who are tremendously expert at knowing how to do exactly that work. I think that rather than seeing this as an other situation, There is 2.1 million Americans. By point of example, that's the same size of a population as people living with Parkinson's, right? So how many folks do you know who have a friend or loved one who's living with Parkinson's? We are everywhere. And depending on your attire, you may or may not know that the person sitting next to you on the metro in the morning is a person living with limb loss. I do think that lived experience is expertise. We know that there are ways in which we can learn from each other. I just think that rather than seeing this as a difference, we actually can benefit from engaging everyone in our community who happens to have been able to overcome challenges. And that is not to suggest that every day is easy, but there is, that's part of why No Amputee Alone is a big part of our mission. And that is so that folks can get to know each other. Our national conference goes on through the end of the month. So if folks want to join the national conference, we have support sessions and all sorts of breakout sessions so you can get to know other people living with limb loss. And I just really appreciate the opportunity to talk about not only the access to assistive technologies that allow us to get around in our lives as best as possible, but also to think about this is a community that has some wonderful attributes, and life is very challenging for many folks right now, and knowing folks who've been through challenges and are surviving and thriving in spite of them, I think is a way in which we can also enrich our own lives and enrich the lives of the folks that we work with. And the
well, let's not be the last word. I think one of the things that we all need to think about, we should think about how the country should be shaped to be hospitable to all Americans. Mm-hmm. There's a justice piece to this, but there's also a calculus. We tend to look at the cost only. But if we look at it as net benefit, right? Yes, helping people with limb loss is costly. But if we look at it as net benefit, it is less costly to help than it is to not help. In other words, it costs more to not help. It's not as if we have a choice of either there's going to be a cost or there's going to be no cost. It's a comparative cost. So not helping creates a higher cost than helping. And if we think about it in those terms, we will invest. Mary Richards, President and CEO of the Amputee Coalition in Tennessee, and Lucy Fraser, Executive Director of the Limbs for Life Foundation, Oklahoma. Thank you so much for sharing your knowledge and wisdom with us. Thank you for educating me. Thank your communities, your constituents, your clients, your funders, and really stay safe in this crazy COVID time. Keep doing your great work. Attendees, thank you for your contributions and for your attention, and we'll see you on Tuesday.